Hi, thanks so much for staying with me. I'm Melissa Idris. You're watching Consider This. We're discussing the Omicron BA.5 subvariant, which the Health Ministry warns is very likely to have already spread throughout the country and may lead to a surge in COVID-19 cases and hospitalization. So how should health policymakers and the public be thinking about mitigating this next wave? Joining us now is Professor Dr. Sharifa Ezat Wan Putih. She's a specialist in health economy and public health at Universiti Kebangsaan Malaysia. Dr. Ezat, symptoms of the BA.5 variant are said to be less severe than the first Omicron wave. I'm just wondering how you would address, what would you say to those who have the impression that it's fine to get infected if the disease is mild, that we just should treat it like a normal flu? What would you say to that?
Right. Thank you, Melissa, for the questions. It has been some of the research have shown it is less severe, but it's very highly transmissible. When that happens, some of the research has shown that the virulence is less compared with Delta and so forth, and the early Omicron wave, as you mentioned correctly. However, we cannot take it to heart that this is going to be less hitting and things like that, because we don't know our risk. That's one of the problems. The second thing about the so-called the BA.5 and BA.4, in fact, it's able to evade the immune system, meaning that whatever vaccine that has been put into you, they are able to, evade that immune system in a way, so that makes you more susceptible. And of course, with the waning neutralizing antibody that we have, most of us have had the vaccines, even the booster, maybe about 6 months, 4 months ago. So that will actually show some declining in antibody as well. So meaning that it makes us more susceptible to this virus. So and we know that most of the cases that comes out, or basically the infected people, would come up with so-called the category 1, 2, but a few would actually progress into category 3, 4, and 5. So this is where the severity, or basically the risk of you getting admission and also getting ventilated, is even higher. Of course, now, in Malaysia, we have other problems as well. We have a huge number of people having multiple comorbidities, multiple problems as well, diabetic hypertension, obesity, and so forth. So that puts us at risk, especially if you're a smoker, you have existing lung problems and so forth. You might have also COVID, but you don't show the symptoms so much. This is also another worrying thing, because you can actually transmit it to other people without actually knowing that you actually have that. So coming back to some of the changes in SOP, or probably some of the reinstatement of public health programs that should be in, I think we are already wearing masks indoors. I think that should actually, you also need to wear outdoors, especially if there's a huge number of people around, maybe, majlis and things like that. And we also need to test more regularly. The latest positivity rate from our COVID Now website is about 7.5, like that, 7.1. And that shows that a lot more people are testing positive now. That shows that more people are having this virus, and it's actually going around and so on. We are in the transition of endemicity, and we know that once you go into endemicity, that means the virus is going to be in the community. But there's still risk of you getting infected, and there's still risk of you getting infected and also warded, and so forth. So again, for those who have not got their vaccination or get their booster, you should get your booster. If you are able to go for your second booster, please go ahead and get your second booster, especially for those who are elderly, for those who are immune compromised, having multiple morbidities and so forth.
Dr. Ezat, what about the rest of the population? Should universal coverage for boosters, the fourth dose, be not just for vulnerable groups and those with comorbidities, but universal coverage that covers everyone back to the way we had with the first round of the national immunization program? If from a public policy perspective, do you think that's necessary?
Well, it's not surprising that many countries have actually go ahead with that, Melissa. They have actually proposed for the so-called the second booster or the fourth dose in their population. But at this point in time, for Malaysians, I suppose this is not something which can be done compulsory. I think this is still optional. That you are able to go ahead for your vaccination, and please do, if you have the options, to go ahead for your fourth vaccination. I think at one point in time, if the rate is actually very high, is increasing very rapidly, and we see that this is going to be another crisis, I think the compulsory will come a bit later.
Okay. And if that does happen, then are there lessons from that first rollout that you think might be applicable? Because if I remember correctly, the take-up rate for the first booster was not very encouraging, at least at first. Are there practical ways that you think might be that we can learn from previous mistakes that might increase participation this time around?
Right. I think a lot of countries have actually imposed some incentive, Melissa, incentive for vaccination, coming to the clinics or coming to obtain their boosters and so forth. Different countries have different so-called incentive. It can be some tax incentive. It can actually be giving monetary values for the transportation and so on. So that would be something in line with Malaysia as well. We can actually do that and propose incentive as well. But again, the rate of the booster, we're talking about the first booster, is still below 50%. And when that happens, my thinking is that where are the vulnerable, and especially for the elderly, we need to make sure that they are basically protected, and we need to have an inventory of elderly people in this community, because they are at risk. We need to protect them, and of course those who are able to access healthcare and obtain their second booster, this is very important for them to come forward.
Right. Dr. Izzat, wait, you said less than 50% of the elderly, less than 50% have taken up, the population have taken up the first booster dose, the third dose. Can I ask you, what are the implications of waning efficacy of vaccines? So you take a vaccine in 2001, and by the end of 2022, you take a vaccine last year in 2021, by the end of, say, 2022, that vaccine, the efficacy, your protection would have waned significantly. How would public health policymakers think about this timeline? And is it up to the personal responsibility, or is this an issue for public health policymakers?
Well, the declining vaccine efficacy is not only for Malaysia. It is happening worldwide. As you know, that most of the vaccines that we obtained are done in either at the end of 2021, or some of us are early 2022. And there are reports that shows that some of the vaccine efficacy may go down up to 40%. Some research will go down to 60, and so forth and so forth, meaning that the endpoint is that we are actually facing vaccine declining efficacy based on some of these reports. So when that happens, there is a need for us to so-called boost our vaccine back again. This is where the second booster comes into play, also called the fourth vaccination. When it comes into the public policy, not only vaccinations are the main stay of so-called management. Other management things like SOPs, wearing masks, washing your hands, ensuring that you don't go into congregations, into big meetings without actually testing. And these are simple policies that are actually effective. And other countries have actually done that. They have actually done working from home. They are implementing working from home again for some of the population. Rotating schools, children again, in some countries as well. So meaning that there are other policies as well for management of COVID. It's not just vaccination, although vaccination would be so-called the prime, or basically the most important, but there are other sorts of management in place that we have, the country can actually look at that as well.
Yeah. I mean, this is very reminiscent of the conversations that we had at the start of the pandemic. But now I feel that perhaps there's some complacency that has set in, or rather, as we learn to live with the virus, a lot of things have reverted to the way it was pre-pandemic. I do want to ask you, now that lockdowns are no longer part of the playbook, but what does the high number of infections and reinfections mean for a society? When we think about, high workplace absences, if you couple that with increased cost of living, that means that more people feel like they have to work when they're sick. Are there conversations being had, Dr. Izzat, about the long-term impact of widespread infections and what this will have on society, the impact it will have on society?
Right. So, Melissa, there's so many aspects that you mentioned just now that we can dwell on that. If you're looking at health, the most important thing would be the emergence of long COVID. Long COVID may actually occur in there's some reports that says it's about 15 to 20% of the patients, or basically people who have obtained or basically got infected with COVID. So if you look at the number of population that has been infected with COVID, it's about 4.6, nearly 4.6 million people having infected with COVID. I'm not talking about the one that died as well, but this is talking about, so if you took 20% from that, that is already about 900,000 population plus. So if you can imagine 900 plus thousand population that would actually present with some sort of long COVID, and long COVID can present, at some point in time, and it's quite difficult to diagnose and things like that, they may actually have impact on their attendances, on their MCs, not able to work, difficulty in focusing, and so forth. So this would lead to loss of productivity, and basically it's going to get worse if they have also financial constraint. Melissa, there's a lot of people, we have our B40 so-called, we have our M40 and things like that. These are the people most at risk of not only financial but also health impact, and this is something that the government needs to look at more diligently.
Thank you, Dr. Ezat, for bringing that up, and appreciate your time and your insights.
Most
Thank you
welcome.
for sharing that with us tonight. That was Professor Dr. Sharifa Ezat Wan Putih. She's a specialist in health economy and public health at UKM, and that wraps up this episode of Consider This. I'm Melissa Idris, signing off for the evening. Thank you so much for watching, and good night.